To me, one of the more persuasive criticisms is that, so you convert to a voucher system over time. The vouchers, though, do not grow at the rate according to what medical costs are rising, at least right now. Now, if medical costs stop rising and that turns around, then that's not a problem. But if they continue at the current rate, then eventually, those vouchers would pay for less and less of seniors' health care.
So let me ask you this. Do you get health care from the Wausau Daily Herald?
I do.
Okay. And is that a voucher? They give you a slip to go, this can be used so you go purchase health care wherever you want? Or do you have a plan that you can pick from within, is it a voucher?
No, I understand it as a plan that I pick from.
Right. And you'd say that's not a voucher, right?
Yes.
Yeah, and so let's not call this a voucher, because that's not what it is. It's not a voucher plan. And I think that's a term that people use to try to scare seniors to go, we're going to turn you out into the wild with a voucher. That's not what we're doing.
Well, then
it's a structure.
The portion that would be paid by the government.
Well, you would never use the term voucher in regard to what you get. So that's not what we're doing here. It is a premium support, which is probably what you get. The Wausau Daily Herald pays for a percentage of your care, and you have to kick in some as well. And the difference will be you probably only have one choice, but a federal employee has, a packet of choices that they can choose from, where it's a slimmed down plan where they pay very little, or they can get a gold-plated plan where they pay a lot more. Seniors that have that same choice. But what our belief is this: if we start to empower patients, empower families, empower people to make decisions that work for them, and we start to get people to engage with price and service in their health care, we are going to see more efficiencies in the marketplace. I think that a freer marketplace will drive prices down. We've seen it in regard to everything. I think that's how we're going to accomplish the goals. What we have right now, though, is a current system where we see increases in cost year over year, and all we're trying to do is change who's paying for it. Or what we're doing is saying, okay, well, the government's only going to pay less and less for Medicare, and then you see these doctors and hospitals pass it back on to people that have care or insurance. And on the back side, we're double paying. We're paying for Medicare, and then we're paying for incredibly increased cost. So
did you say healthcare costs are going to go down?
Well, he said healthcare costs are going to increase at 7% a year, and it doesn't increase with it.
So you're disputing that rate of increase.
Yeah, I think that if we inject more competition in the marketplace, more choice into the marketplace, more ability for patients to actually purchase plans that work for them. Make insurance companies provide plans that work for me. Because I got to tell you, what works for me and my 6 kids may not work for Rob and his family. Or what's good for us in central Wisconsin may not work for guys in Kansas and Kentucky or Minnesota and Michigan. There's different values, there's different ideals. And so let's let people choose. And if we do that, I think we can be far more effective than what we're doing today.
So why not do it now? Why not do it to people who are on Medicare or approaching retirement age? The baby boomers are the biggest single bubble in history that's going to be driving up those costs. Why not subject them to it? I mean, you want to cut up the credit card now, right?
Right. So here, the reason I don't think we should do that is people have built their retirement around this program. And I don't think it's right that you say, okay, now I'm 65 and you want to take this away from me. I got to go back into the workforce and try to make up this difference. I don't think that's reasonable.
We do that all the time. I mean, for example, we gave them prescription drug benefits that they presumably had budgeted to pay for prescription drugs in their
You can run for Congress and you can propose that. You ask me what I'm doing. I don't want to take those benefits away from seniors. But future generations, you can say, okay, this is the plan that you're going to have. You can plan for that retirement. In future generations, but this generation plan for this retirement, and I think they should get it. And so, and some people will look at our proposal and they'll go, "This is extreme. What are you doing?" And I go, "Extreme? Do you know how long it takes us to balance a budget? It takes us out to 20, almost over 40 years to balance a budget. Over 30 years to balance our budget."
In that plan.
In our plan that we voted for, and the reason is we're not willing to cut current seniors. So we're okay projecting out and bringing the cost down because we're not going to take away from those current retirees. And so when you do that and you look to future generations in that reform, it takes a little longer to get there, but it's a plan to get there. The alternative is a launching debt that's going to, I think, crush the country, but no doubt crush the next generation.
That's an alternative. Another alternative is to ask people at or near retirement age now to pay more. It's just it's an alternative you reject.
Well, there's a lot of views out there. You asked me for my view. There's a whole spectrum, there's some people who, there's a lot of views out there. Yeah, so you asked me mine.
Can I ask if you permit a political question?
Sure.
You said that you're taking some flack already for this budget proposal. I think that a lot of House Republicans are. Are you surprised at the way that this has gone? Are you disappointed by the way the politics have shaped? Are you pleased?
No, listen. First of all, from people here, when I go talk to them, no, I'm not. I mean, people listen. There's a segment who go, I don't like it. There's a segment that goes, I love it, and there's a segment that goes, tell me more. Now, I'm saying on the political campaign side, it's we have got interest groups that are running ads here. So those are the people that are trying to tell our current seniors that I want to take something away from them. They're trying to scare our current seniors, and it's disingenuous because the current proposal, the current plan that's out there right now, what exists today, the Medicare trustees tell us it can't continue. We're already spending more than we bring in, and the trust fund is gone in 2024. And so let's fix it to save it.
Does the plan give me some idea, though? I keep making this personal, I don't mean to, but just for example's sake, of what my premium support would be, and then an estimate of what my sort of percent of out-of-pocket costs would be?
And I think
so I know what that's going to look like?
Yeah, sure. We'll have to drill into the details. This was the broad-based budget proposal, so the details will have to be worked out. But yeah, we'll work through it.
Would you understand some fear in the uncertainty of those details at this point?
Possibly, but I would also, there should be similar.
I mean, let's take the whole scaring seniors thing out of it. Okay, you said 55 and up,
Yeah.
get their plan. I'm just talking about people below that level, not knowing exactly what this is going to mean for them, could have some legitimate concerns, right?
Well, I think if people understood where we are today and what would exist if nothing is done, I think they would go, yes, I think we need to reform it. Why should Rob pay in for a lifetime and get nothing out of the program? Let's make sure that Rob continues to have this social contract where he's going to pay him, but there's going to be something for him. And if he doesn't think he's going to get it, it's hard for me to sell him that he should keep paying into it. So yeah, we have to work on more details of what it would cost at different income levels. You're right, but when you talk about what's frightening is the current plan that exists today is going to fade away because it's unsustainable, and everyone says that. Everyone says it. The Senate will say it. The President will say it. The trustees say it. And so the choice is truly this: do we look at a reform? I'll listen to any kind of reforms that come out. To go, I've got a better idea. Let's talk about it. I don't want to see us ration care down to nothing, however, and using 15 unelected bureaucrats to decide what gets paid for and how much. I don't like that. I don't think that is a recipe for success and good care for our seniors looking to future generations.
So, as long as we're on healthcare costs, let me ask about healthcare reform. In January, when you voted to repeal healthcare reform, you said that you had spoken with leadership and that March or April there would be bills, replacement bills coming out of committee. It's getting into late May. That hasn't happened. I don't expect that to happen. I don't know anyone who expects to see a sort of a broad replacement bill. Do you feel like you were misled by leadership?
So I've had another conversation with leadership on when are we going to bring these to the floor? Because I voted for repeal with the commitment that we're going to have a replacement. Because frankly, to repeal a proposal that I don't like without putting our own proposal forward brings us back to what we had before, and I don't think that's acceptable. So it's my understanding now that in the fall, they're coming out. I'm going to work on my own legislation right now, and for a certain segment, and I'll tell you more about that as we move forward in future weeks. But yeah, I would have liked to have seen it come out earlier. But we will see our proposals coming from the House side.
Do you, I mean, I don't know, I don't, maybe it won't happen this way, but it's possible to imagine that we'll sit here in the fall and say, well, they didn't come out in the fall, where are they?
And then I will pull my guns out with you and go, listen, I was misled. Yeah. Where is it? And I voted for this with the understanding that this is what we're going to do, and our reforms are going to be able to come to the floor. And I would tell you at that point, I'm incredibly disappointed in our leadership for not allowing those to come forward, because I think that we owe it to the American people. If we're going to criticize the president's proposal, we should bring out our own, most definitely.
At this point, you have full confidence in the House leadership, though?
At this point, I do, yeah. I've talked to them again.
Not just on that issue, but in general.
Well, I mean, do I agree with them on everything? No,
is it showing itself to be effective yet?
What's that?
The current House leadership.
What do you mean by effective?
Getting legislation